Let's talk about something most medical practices underestimate: the true cost of administrative support. If you're running a medical practice, you know you need help managing appointments, billing, insurance verification, and patient communication. The question isn't whether you need support, it's how to get it without breaking the bank. Most practices hire an in-house medical admin assistant. They handle front desk duties, greet patients, answer phones, verify insurance, and manage scheduling. It feels like the obvious choice. But here's what most practice managers don't realize until it's too late: that administrative assistant costs far more than their salary. Let's break down the real numbers. The average medical admin assistant earns between $39,000 and $45,000 per year. That's just the starting point. Add employer-provided benefits, health insurance, paid time off, retirement contributions, and you're looking at an additional 25 to 35% on top of that salary. But we're not done yet. There's overhead, office space, equipment like computers and phones, utilities, office supplies, IT support. That adds another $3,000 to $5,000 annually per employee. And don't forget training costs, payroll taxes, and the reality that even your best employee spends 10 to 15% of their time on breaks, sick days, and non-productive activities. Here's a real example. You hire an assistant at $42,000 per year. With benefits, that jumps to $55,000. Add payroll taxes, equipment, training, and workspace costs, and suddenly you're spending $61,000 annually for that one position. That's 45% more than the base salary you thought you were paying. Now, compare that to a virtual medical admin assistant. These are trained professionals who work remotely, handling the same administrative tasks but without the overhead. They manage appointment scheduling, insurance verification, billing, EHR updates, prior authorizations, and patient follow-ups, all from a secure HIPAA compliant environment. The difference? You pay only for productive hours. No breaks, no idle time, no office space, no equipment costs. Virtual assistants come pre-trained in systems like Epic, Athena Health, and Cario, so there's minimal onboarding time. And because they work remotely, many can provide after-hour support or coverage across multiple time zones. The cost comparison is striking. That same $61,000 in-house assistant, a virtual assistant providing equivalent hours, typically costs between $30,000 and $35,000 annually. That's a 40 to 50% savings for the same level of productivity. Let me give you a real-world example. A mid-sized pediatric practice in Texas was running 2 full-time in-house assistants. They switched to 1 front desk staff member plus 2 part-time virtual assistants. The result? They cut their admin costs by 46% and reduced missed appointments by 20%, thanks to consistent reminder calls and texts handled by their virtual team. The bottom line is this: virtual medical admin assistants deliver the same quality of service without the overhead burden. They're scalable, cost-effective, and trained specifically for healthcare administration. If your practice is spending over $50,000 per administrative position, it's time to rethink your approach. Virtual support isn't about cutting corners. It's about cutting costs while maintaining or even improving the level of care your patients receive. Ready to see what virtual administrative support could do for your practice? It's time to stop paying for office space and start paying for results.